has said something. He said that the best way to appreciate God for the gift of your sight is to help somebody in the dark. The issue of blindness is staggering in Nigeria. A global picture of blindness, over 1.1 billion persons cannot read small print, and that is staggering. And it will interest you to know that simple glasses can solve that. 1.1 billion persons on earth over 35 years cannot read small print. They are talking about blindness. 43 million people are blind globally. And this blindness, half of those 43 million people is caused by cataract. What is cataract? Cloudiness of the lens that is inside the eye. And cataract can be solved by simple surgery. And the technology is with us. 9 out of 10 persons with visual impairment live with us, low-income countries. They live with us, 9 out of 10. And over 90% of the issue of blindness are treatable, preventable, and we call them avoidable blindness. But why are we poor? In Nigeria, people have studied, and they find out that the prevalence of blindness, I will explain that simply, is 0.78%. If you calculate that by a projection of 200 million, that means about 1.5 million people are blind in Nigeria. And over 80% of that blindness can be treatable by simple means. Talking about Delta State is a difficult terrain. We have upland, we have lowland, the creeks, and those terrains are very difficult to navigate. So this is the issue of blindness that we have. Poverty is a very big problem with blindness. Poverty. Why poverty? We have so much resources, but not available to all. When you are talking about blindness now, how does blindness affect individuals? I met a man, if you remember, there used to be a Chinese bakery, if you live in Asaba. And I saw this man some months after he has regained his sight. This man got blind. Issue of mental health was also entertained. He stopped taking his bath. And when the children say, come and have your bath, he said, blind man does not need to take his bath. It was that bad. For 3 months, this man hasn't taken his bath. He heard that somewhere in the stadium, 2018, that some people came for blindness intervention. A neighbor assisted him, and he came. And this man underwent surgical operation. The next day, the eye was open when we removed the dressing, and he saw himself. He said, am I this dirty? Please take me out of this place. He could appreciate the issue of how dark he had been. And that is the story reflected in so many places. Somewhere in Ole, a man got blind. His son got married. He has never seen the son's wife. The son gave birth to a son. He has never seen the grandson until we went to Ole, Ozoro Aziz, and the man was operated. And he could see the daughter-in-law, so he didn't know whether she was tall, dark, big, slim. He didn't know the son. He has never seen him. So that is the stories painted all over Nigeria. Blindness is a very big issue in our country. But it appears they are left in the dark. I saw another man in the creeks. This time we were in Burutu. Young man of about 40 to 50. And I saw him being led by his sister. And I was curious. Where is your wife? He said, my wife left me since I got blind. But the next day, he regained his sight, and he was seeing, and there was joy all over the land. You see, Restore Sight came into picture. We're about 7 years old now, actively. But the journey of restoration of blindness, I'll tell you the story. In my final year in medical school, Dr. Dini Fibrisma, late Dini Fibrisma, was organizing what they call eye camps. He took us to stadium, was coaching us. He was an ophthalmologist, a pastor at about 44 years old. Ophthalmologist. He was telling us issues of blindness and how you can solve them. And I got inspired. Initially, being a doctor, my dream was to be a gynecologist. And I prided myself. I would be delivering babies. I would be attending to women. But when I said critically, I'm not despising that profession. I said staying awake to wait for one woman to deliver all night. I don't think that is my idea of fun. I would rather go for sight. So after my service, after my medical school, we went for youth, and I came to grasp of the burden of blindness in the community. It is huge. It is huge. So when I finished school, I started work. I wasn't satisfied like every other Nigerian who want to travel out. So I had a small stint. I got out of Nigeria, and I went to 2-3 countries, and I came back. Why I went out there, I saw how they could intervene in community health, how people's sight are being restored in Kenya, in the Gambia, in the UK, and I said, this can happen in my country. And I came back to Nigeria, and I started approaching people. Nobody was listening to me until I wrote something, opportunity come to those who are prepared. I did a 12-minute slide, and what was the title of that slide? The Journey to the Restoration of Sight. 1,000 sites begins with a step into the community. And our governor's wife heard that. And within 2 weeks, we were in 25 local governments in Delta State, restoring sight and bringing that to be. So my advice to young people is that you can do it. What makes us different? Number one is innovation. It's good to train as a doctor, and you sit in the consulting room. How many people really come to see you there? The best you could do is that you attend to 20 people in a day, 30 people. But the issue is in the community. Why 90% of health workers, eye health workers, live in the town? 90% of the problem is in the community. And that is what I call the 90-10 paradox. Who is going to go into the community with issues of insecurity, with issues of uncertainty all over Nigeria, but somebody has to step into the community. And that is why we say Ghana has to go to town to solve the problem. Sitting down, you are limited. But going, we can do mass surgery. So innovation took us there. We brought the solution to their doorsteps. You know what? When somebody is sick, the direct cost is there. That is the amount you pay when you are being attended to. The indirect cost is that transportation is an indirect cost, feeding is indirect cost, accommodation is indirect cost, and that builds up to the entire cost of the treatment. So we circumvented that by going to their community to solve the indirect cost of transportation, accommodation, and that within the environment, somebody can buy food for them. So that is what we did. After we moved all over Delta State in 2018, we were using case files. And when we came back, we had more than 27,000 case files. And you know that is big trouble. A whole room filled with case notes. We couldn't even analyze it. And we started thinking, what do we do? Innovation. So we got some of our partners who developed apps that we use in our devices. So these days, when we go into the community, we just carry an Android phone or devices. And from there, we make our entry there. The data is self-analyzed, and we're equipped with that. Passion is another thing that drives us. We have a group of 30 volunteer workers that go into the community. The culture of volunteerism. All the speakers I've talked about, Nigeria is in dire need of volunteers. People no longer want to volunteer to do anything. Once you call somebody, what is in it for me? You pay me, I do it. And I tell people, volunteerism, sacrifice is the wheel that rotates the earth. Without sacrifice, no nation moves forward. So we've got this team of volunteers. In fact, our interview, when we call you, would you like to work with us? And it's how much am I being paid? You're already canceled from the program. Because we're working with volunteers. How do we translate the huge cost? Nobody should be impoverished delivering eye care or receiving eye care, both the provider and the receiver. We have solved the problem for the people, free eye head. For the people who want to sponsor and for us to, the cost has to be minimal. And that is why we devised the low-cost technology to address the issue of blindness. So our team go as volunteers. Secondly, partnership, healthy partnership. We partner with people, and we are accountable. And we also use limited resources. What we are seeing, never invented by us or anybody, it's just that we've studied other models, and we are replicating it in our environment. In 2018 alone, over 40,000 persons were attended to. We gave glasses to more than 25,000 persons. We did surgery about 2,500. That was 2018. Then the pandemic struck, and everybody was sitting at home. But we also think pandemic did not stop blindness. People were still getting blind, and what do? And we carried out the eye heads around the 3 senatorial districts of Delta State. What did we do? We learned the best way of how to walk in the midst of pandemic by putting on your face masks, social distancing, washing your hand, but by all means, you must provide eye care. Now, causes of blindness in Nigeria. Number one cause, I'm not going to bore you with cataract, glaucoma, refractive errors. Of course, those are medical jargons. The number one cause of blindness in Nigeria is poverty. 67% of Nigerians don't have sufficient funds to take care of their needs. WHO proposed that out-of-pocket expenditure should not be more than 30%. That means you go to the hospital. What happens in Nigeria is that before you enter the emergency room, you pay for the card. You pay for your medicine. That is out of pocket. National health insurance is 5% in Nigeria, and it's only for federal workers and a few states. So what do? That is why when we go into the community, we remove the issue of costs for them, and the uptake is high. There's what we call cataract surgical rate. What is that? The number of operations, of cataract operations you do per million population per year. WHO recommends that it should be 4,000 per million population per year to solve the problem of Nigerian blindness. We are about 417, which is still quite low. So we need to build healthy partnership to move people who are blind and bringing them to sight. That is the thing. Then other innovations that we have also seen in the thing is the issue of, if you walk into McDonald's or KFC or any of the fast food, before you sit 5 minutes, they present your meat pie and your food. They've developed that. Or in a racing car, Formula 1 or so, the tire gets back within less than a few seconds. They've changed the tire. So we studied the Indian model. And what does that do? How do we do high volume quality cataract surgery? And we devised that in the theater, I operate with 2 tables. What does that mean? A microscope, 1 microscope, 2 tables, 2 assistants. So while you are working on this person, your other assistants have cleaned up the other person, get ready for surgery. All you just need is your rolling chair. You move to the next. You start operating, they move the other one. And that way, we are able to do high volume surgery. The story has been the same from Asaba to the creek to all over Delta State. People are blind and they need to see. The blind man wants to see. But until we move into the community to provide access to them, make it affordable, make it available, and sustainable. We're talking about sustainable healthcare. Until we move into the community, people will remain blind. And even then, blindness is not the end. There are some blindness that are irreversible. For example, glaucoma blindness. When we meet somebody in field with glaucoma blindness, what do? Glaucoma has a family history. Black race. We do medical education there. Do you have relations? They say yes. Have they ever checked their eyes? No. Because glaucoma is called the silent thief of sight. Nobody knows the warning. They just notice they are blind. But you can help your relation from not becoming blind by let them go and check their eyes. It surprises me in Nigeria that you see somebody, a young man with mobile phone, with all the Android phone. He said, I went to the doctor. What is the name of the doctor? I don't know. What is your diagnosis? I don't know. What is your treatment? I don't know. So ignorance is another cause of blindness in Nigeria. Then, of course, the brain drain. We will not end this thing without saying that 2,000 doctors leave every year out of Nigeria. We've tested a little bit. Even my children used to ask me, why did you bring us back to Nigeria? I say, well, this is what I'm doing. Maybe your time, you people can go out and go and study, but here is where I found relevance. Because the joy I see in the faces of the people when their sight is regained, I can never get that working in England, nor working in America, or working in the distance. And for all you do, the restrictions are there. So we're back to Nigeria, and we're doing this, and we're seeking partnership. And what next? What do we do next? Our vision is to build a base hospital where we can move around a kilometer of over 200 kilometers, screen the people there, bring them to the base hospital, operate them, and they regain their sight back, then we can truly say that Nigeria can see. And again, young children happen to be affected by issue of blindness as well. You notice I had a professor in Benin then when I was doing my postgraduate. The son went to school, and simple maths they put, maybe 83 over plus 4. He didn't see one side of the 8. He saw it as 33 plus 4. Simple glasses can correct that. And when he wrote 33 plus 4, which is 37, submitted it to the teacher marked it wrong. And the father went to school, and the teacher said, that is not what I wrote. So simple glasses can help that. And that is what is called refractive error. Simple glasses. If we all put our hands together and united together, we can solve the issue of blindness. There's an African proverb that says, how do you eat an elephant? It says, by calling a lot of friends. And that is how you eat a whole big elephant. The blindness is an issue, and I think we can save it. Thank you very much.